I did over 20 years in the Marine Corps with over 15 years serving in the IT department with real-world experience on how to deploy IT across Afghanistan, Iraq, and across bases and ships, and retired in 2017. About 6-7 months into it, my wife politely told me that I needed to go get a job, that I was just going crazy at the house, and so initially came on with Mercy Ships to volunteer, really trying to get in to help them out, equip the Global Mercy with all its IT gear and get it ready to go into operations. The moment I showed up, I was like, this is destiny. This is where I'm supposed to be and spend the rest of my retired life. Mercy Ships is a non-profit organization, and we service the low-income countries of Africa by providing hope and healing to the world's forgotten poor. We provide free surgeries, and not only do we provide free service, we provide training to local health professionals in that country, so when we leave the country, we can actually leave them in better care than they were when we got there. So picture a 175-meter ship that's 13 decks high, so picture that broken down in 5 fire zones. Partnered up with teams like Presidio and Cisco. Cisco is our backbone for most of our infrastructure. Phones, Wi-Fi, marine operations equipment, radiology technology equipment, CCTV cameras in a hospital room so that the doctors can communicate, all connected through those switch stacks. So those IDF Cisco switches that we have throughout the vessel, and it's our main support and our lifeline out to keep doctors updated so they can actually communicate with doctors out in town, and it controls all that. Cell phones doesn't necessarily work, so our call manager, Cisco call manager system is tied to the marine operations paging system. Crash alarm systems in the hospitals for monitoring patients and being able to connect to nurses is all done through a Cisco device that connects back to our data centers, that connects back to the human that walks around there, being able to complete their mission.
What makes you feel great about what you do? Why are you doing it?
Smiles. The mission, the meaning for what we do, to actually help people and to see not only in the patients, just to see their smile and see things that happen through there, but the volunteers and the workers. It's like a family, and they want to be there. They want to do what they want to do. They want to provide for the world's forgotten poor. And just, for example, we were doing a survey for the ship to get ready to go on the refit. Was able to walk through the hospital wards. Kid just ran up to me and grabbed a hold of my leg. He grabbed it, got it in my arms, and I was able to walk around pretty much the wards with this kid in my arm, talking to the nurses about, hey, how can we help? How can IT help you out? Come to find out, the kid originally got there had, I'm gonna say bow-legged, I'm not sure the correct terminology for medical for it, but they were able to do the surgery, go through rehabilitation, and the kid was actually now running around the vessel. And the fact that just so happened to walk in and grab him in my arms and to see his smile, and the whole time he's in my arms, all you see is his grin and just happy to be there, running back and forth. I'm set for life after seeing that, and it made it so worthwhile. It's an emotional feeling that you get from that you'll never get anywhere else.